Hi everyone. In today's video, we're going to break down the different types of diagnoses used in veterinary pathology. Whether you're a vet student, a pathology resident, or preparing for board exams, this video will give you a clean and practical understanding. Let's start with the types of diagnoses in veterinary pathology. Diagnosis is one of the most important goals in veterinary practice and pathology because it guides treatment, prognosis, and disease control. In veterinary pathology, achieving a diagnosis involves integrating several types of information: clinical findings from the animal, gross or macroscopic observations, microscopic or histologic changes, and laboratory test results. Together, these pieces help us move from what we see to understanding what disease process is actually happening in the animal. A clinical diagnosis is formed primarily from the animal's basic information, such as age, sex, and breed, along with its history and the findings from a physical examination. Even when laboratory results or imaging studies are available, this type of diagnosis is often only provisional, helping guide initial decision-making. A gross diagnosis is developed by examining lesions that can be seen without a microscope. These observations may come from a physical examination, an endoscopic procedure, surgery, or a necropsy. In some cases, gross findings alone can confirm a diagnosis, such as visible fractures or obvious traumatic injuries. However, most visual assessments are followed by histopathology to confirm the nature of the lesion. A morphologic diagnosis summarizes the structural changes identified in tissues, either grossly or microscopically. To build this diagnosis, pathologists describe the lesion using elements such as degree, duration, distribution, exudate, modifiers, and tissue, DDDEMT. This approach helps categorize the lesion, whether it represents necrosis, inflammation, vascular disturbance, or abnormal growth, and indicates exactly which organ or tissue is involved. For example, hepatic necrosis is a complete lesion name, but adding descriptors like multifocal suggests an infectious cause, while centrilobular points toward metabolic, toxic, or ischemic injury. Morphologic diagnoses may stand alone or support the creation of a differential diagnosis list. When describing lesions in pathology, we systematically use several descriptors. Degree indicates severity, from minimal to marked. Duration tells us if the lesion is acute, subacute, chronic, or chronic active. Distribution describes how lesions are spread in the tissue: focal, multifocal, locally extensive, diffuse, or cranioventral in the lung. Exudate characterizes the type of inflammatory fluid, such as serous, fibrinous, or suppurative. Modifiers provide additional information, like necrotizing or hemorrhagic. Finally, we specify the tissue affected, for example, hepatitis in the liver or nephritis in the kidney. Using these descriptors ensures clear, standardized communication in pathology reports. A differential diagnosis is a prioritized list of the most likely diseases or conditions that could explain the findings. Typically, 3 to 5 possibilities are included, arranged from most probable to least probable. This list evolves as additional information becomes available, from clinical signs, necropsy or biopsy findings, and laboratory testing. The purpose is to narrow down potential causes until one can be confidently identified. A definitive diagnosis identifies the exact cause of disease. In some cases, like well-differentiated tumors or traumatic lesions, morphology alone is enough. Most other diseases, especially infections, need ancillary tests such as microbiology, IHC, or PCR to confirm the causative agent. Essentially, we start with what we see and use targeted tests to reach the definitive diagnosis. An etiologic diagnosis emphasizes the cause of disease rather than its appearance. For instance, a foal with liver lesions might have a morphologic diagnosis of acute multifocal necrotizing hepatitis. Once a Clostridium species is suspected, the diagnosis becomes Clostridial hepatitis, the etiologic diagnosis. However, only identifying the exact agent, Clostridium piliform, gives the definitive diagnosis of Tyser's disease. Etiologic diagnosis is helpful but may not pinpoint the precise pathogen. Today we'll talk about anthrax, a serious bacterial disease caused by Bacillus anthracis, to explain different type of diagnosis. Anthrax primarily affects herbivores like cattle, sheep, and goats, but it can occasionally infect dogs and humans. Early recognition is crucial because the disease can cause sudden death and has public health importance. Clinical diagnosis. Clinically, anthrax often presents as sudden death in otherwise healthy animals. Other signs may include fever, weakness, reluctance to move, and hemorrhagic discharges from natural orifices such as the mouth, nose, and anus. Rapid abdominal bloating is also a classic sign. Based on these signs alone, the disease can be suspected, but confirmation is essential. Gross, macroscopic diagnosis. During necropsy, anthrax carcasses show dark, unclotted blood oozing from body openings, generalized edema, and markedly enlarged spleens. Importantly, veterinarians are advised not to open the carcass if anthrax is suspected, to prevent environmental contamination and zoonotic risk. Morphologic diagnosis. Histopathology of affected organs such as the spleen, liver, and lymph nodes reveals septicemia characterized by numerous Bacillus anthracis rods in the blood vessels, tissue edema, and hemorrhage. These findings help categorize the disease as a hemorrhagic septicemia caused by bacterial infection. Differential diagnosis. The clinical and morphologic findings may overlap with other diseases, such as clostridial infections, poisoning, hemolytic diseases, or severe trauma. Hence, a list of possible causes is prepared and narrowed down with laboratory testing. Definitive diagnosis. To confirm anthrax, laboratory tests are essential. Blood smears stained with gram stain reveal large, gram-positive bacilli. Cultures, PCR, or immunohistochemistry can also detect Bacillus anthracis and provide a definitive diagnosis. Etiologic diagnosis. Finally, identifying Bacillus anthracis from blood or tissue confirms the etiologic agent responsible for the outbreak. This step is important for guiding preventive measures, such as vaccination and quarantine, and for public health reporting.